the board of directors for VetsCAN. And on behalf of our board, we're happy that you've joined us for this monthly forum of information sharing. I think just as a heads up to everybody on the line, we are recording today's session for posting on our YouTube channel. So if you've ever missed a, well, I should say, if during the past year you've missed a one of our forums, feel free to check out our YouTube channel, and you can catch up on some of those past forums. So before we get started, I do want to recognize one of our new directors who is on the line today, and that is Will Funmaker. And he was newly elected last month at our annual meeting. And let's see. Do you want to say anything? Well, I'm going to stop sharing my screen so that people can see you.
Sure, yeah. Yeah, I'm just happy to be able to offer any sort of insight that I have. Just learning through the process here and how VetsCAN works, and just happy to be here. I was just a little bit about me again. For those that may not know, my name is Will Funmaker. I work as the director for the Great Lakes Intertribal Epidemiology Center. I'm also the executive director for the Great Lakes Intertribal Health Board. I'm a member of the Ho-Chunk Nation, grew up around the Dells area. I was just over there a couple days ago, so still looks good. I always miss the area, but now currently live in Green Bay, Wisconsin here, so ready for the draft. And my main office is located up in Lac du Flambeau, Minocqua area. So just happy to be here. Thank you very much.
So, Will, you're not renting you're not Airbnb-ing your house?
Oh, I considered it, but I was like, well, then you have to kind of get a contract, you have to file paperwork, I think, with the city, and hopefully you have somebody good that's gonna just leave it well and all that. I just thought it's too much of a hassle, so we'll just stay there on our own.
Well, thanks for being here. And I know we've got our another one of our new board members that's planning to join. He had a conflicting meeting, so he's actually in the waiting room. So I can put him on the spot as he's coming off mute, or as he's as he's getting his audio online. Bill Matthews is also one of our newest board members. And Bill, do you want to say anything? I know you're not prepared for this, but
happy to be here.
All right. Man, a few words. Right to the point. So VetsCAN is, if you're new to us or unfamiliar with us, we're a group of volunteers who are dedicated to identifying and helping to close gaps that exist between the services that VA is able to provide and the services that veterans and their families need to thrive. So these forums are a way for advocates and service providers and members of the community to share information and help develop the veteran cultural competence within the civilian community. A community that we know often wants to help veterans, but they may not have the tools, or they may not feel empowered or know how to go about doing that. So as we're building our community coalition, please invite others into this effort so we can continue to grow. So today, as usual, if you saw the slide that I had up at the beginning, we'll, as we usually do, we'll start with a basic round robin of updates and information. So we'll start with the VA Hospital and the Wisconsin Department of Veterans Affairs. And then if there's anybody else on that wants to share news or announcements or updates, on behalf of your organization, that will be the opportunity for you to do that. And then once we get through the updates, then we're pleased to have our kind of featured topic today, and that's going to be VA disability ratings for veterans. And we've got Kia Lore from the WDVA's Claims Assistance Office to provide us a presentation. And we're also joined by Steve Westfall of the Milwaukee VBA, Veterans Benefit Administration of Big VA, or I should say of the federal VA, who will be on the line. He's not doing a presentation, but may supplement some of the information that Kia provides and will be available for questions. With that, Abe, can we start with you?
Yeah, you bet, Kathy. And I know Joe and maybe Jim will also supplement with kind of some of the event-related activities that we have going on at the hospital. But I'm going to talk more just sort of about, organizationally what's happening within VA. I know that folks are probably following a lot of the national news about, the impending restructuring and, some of the other executive orders that we're working through. A couple of big picture items. We're right now in the middle. In fact, this Monday was the first day of full-time return to in-person work for a lot of our staff. Over COVID, we had a lot of staff kind of shift to telework out of necessity during the pandemic. Post-pandemic, we definitely leveraged telework in a lot of different areas, to help with space management, to help with, kind of work-life balance for employees as a recruiting incentive. But now we're kind of making that transition to having all of our employees back almost exclusively full-time. There are some exceptions to that, but really at this point, for practical purposes, the majority of our staff are back at work. So Monday was a big day for us, having to kind of make a lot of adjustments internally in order to accommodate this, checking to make sure that we have adequate parking, all sorts of other things like that. I am pleased to report that we've completed that without too many roadblocks or barriers. We are also in the process of looking at making sure that we have spaces available for our VISN partners and for national partners who need space to come back to work. We have been able to accommodate some of those requests as well. So that was a big lift because it's just a lot of logistical changes, but I think we were able to respond to it very effectively and to not really see any disruption to veteran-facing services while we're managing that change. So really proud of our team for the work that we've done to bring people back and for the cooperation and flexibility of our employees having to manage that change. So that's one big thing. Of course, the other major activity that we're working on, and I don't really have a lot of information to share with the VetsCAN at this time about the broader VA reorganization. We don't really have any insight at this point into local impacts for that reorganization. National messaging is the same as it's been. The Secretary has stated publicly that the goal is for us to return VA to 2019 staffing levels, which is a pretty significant reduction nationwide. Again, he's stated that that's going to be done without impacting front-facing veteran care. So we're working with that as our underlying assumption for how we'll manage that. We are awaiting the release of that national plan. So we really don't know what's happening locally or what will happen locally, other than that we anticipate it'll be consistent with what the Secretary has stated publicly as far as those goals. We have been working, and I think I've mentioned, one other thing with that is there's also been in the news, I think for a lot of other federal agencies, I haven't seen as many news stories about the VA being offered the deferred resignation program as a means of kind of voluntarily trimming our workforce. That has been announced, and that's something that our staff have until April 30th to consider. So of course, that's one mechanism for us working toward that, reduction goal. And there are process steps involved in that, but staff have until April 30th to opt into that program. We've mentioned before sort of budget related issues. I am very pleased to announce that there was additional money for the VA in the continuing resolution that was passed. We haven't had that funding allocated to our station yet, or to our network, but that should go at least part of the way toward meeting the budget deficit that we have as a facility. As we're working to manage those resource needs, we're working on kind of our own internal planning for kind of leaning our staff to better align our workforce staffing levels with the budget resources that we have. So we have a lot of irons in the fire along all those areas right now, but we've really tried, and I feel like we've been pretty successful at making sure that all of those internal changes are not having a negative impact on the day-to-day services that we're providing to veterans. We're monitoring veteran complaints, we're monitoring veteran inquiries, and we haven't seen a significant change in anything like our trust scores, or we haven't seen delays in access to care. So I think we've been maintaining our services very well in the midst of all of that change. But if there's any feedback from anyone on the call about any perceived concerns or problems as we've tried to navigate this, we want to hear that feedback, so that we're doing everything we can to make sure that our doors are still very wide open, welcoming, and that we're taking care of the veterans that we're honored to serve. So that's kind of operationally where we're at. I'll turn it over to Joe and or Jim to talk a little bit about events we have coming up and other opportunities in the community.
Thanks, Abe. Just want to make sure, Kathy, can you hear me okay? Okay, great. Yeah, thanks, Abe. I'll introduce myself to our new board members and also welcome Will and Bill. We look forward to future collaboration. So thank you for your time and support. My name is Joe Naylor. I serve as the Chief of Community Relations for the hospital here in Madison. I've been with the hospital since 2012. As Abe mentioned, I'm just going to highlight a few upcoming events, internal and external. So a few of these might be good opportunities for your organization to participate and engage with local veterans. So the first event that we have listed, and this is we've selected about 8 out of about 125 events we have scheduled in the next 6 months. So we have a pretty active outreach calendar. But Friday, the 25th of April, we will be at the Sun Prairie Health and Wellness Fair. That'll be at the Colonial Club in Sun Prairie. So the VA will have representation there. We are hosting a blood drive on Friday, the 9th of May. That is open to the public. And I know we still have some opportunities left. If you follow our Facebook page, you'll see some postings there with opportunities to register. Probably our largest event of the year is on Wednesday, the 14th of May. We're co-hosting a health and benefits fair in Platteville. So that'll be at the University of Platteville. So really in an area where we haven't had or hosted or participated in an event like this. So we're working with about 4 counties, the CVSOs, and also the State Department of Veterans Affairs. We have a couple counties from Iowa as well. So it'll be a nice collaborative effort. And right now we have close to about 25 vendors there. So the VA will have a large representative group. But that'll be a great event. Really kind of a focus of ours is to get into areas, rural areas, underserved areas, and we identified the Platteville community and surrounding area as an opportunity there. The 20th of May, which is a Tuesday, the VFW in Madison, specifically Post 1318, is hosting a Veterans Benefits Fair. We'll be participating in that event along with the state and county and a number of other nonprofits. And if you know Gundel Metz, the former state commander, she's hosting that event if you have interest. On the 23rd of May, the Madison VA will be inducting, I believe, our 20th inductee into the Hall of Heroes. So we have a Vietnam veteran, Mr. Stoppelsworth, who was killed in action in Vietnam. we'll be inducting Mr. Stopplesworth on that Friday. So we're excited about that, and we anticipate his family coming up from Georgia to participate in the event. But another real fantastic opportunity to recognize and honor our local veterans. If in that meet, and I should mention that's open to the public as well if you can make it. So that'll be at about 11 o'clock on that Friday. On Thursday, Abe, the Pentad, and our public affairs department will be hosting a virtual veterans town hall. That'll be Thursday, June 5th, I should say. I know Jim is going to correct me if I got that wrong. And if I do have any of that information, Jim, please jump in. But the 5th of June, we're hosting a virtual town hall. And then the last one that I have listed, and feel free to pop in, Jim, if there's anything else, but the annual Madison Vet Fest, it will be on Friday, July 25th, and that is with the Madison Mallards. So we host a large event in combination with the Madison Mallards game. And also it's our VA night at the duck pond. So we'll have a number of employees there as well. So we kind of package all that together and have a fun night at the ball field. So that's Friday, July 25th. So that's what I have. Any questions, or Jim, did I miss anything at all?
Nope, I think you about covered them all.
All right, wonderful. Thank you, Kathy.
Thanks, Joe. Thanks, Abe. And just a note, if you don't have the chat window open, go ahead and open that so that you can take a look at the two flyers that Jim posted in the chat for a couple of the events that Joe mentioned. So anybody, any questions for Abe or Joe? Yeah, go ahead, Will.
Do we, for like this regional veterans benefits fair, do we have the tribal veteran service officers?
Will, I actually have the list for the Platteville event. I can queue that up in my email right now. I'll take a look and I will update the chat. If not, we would most certainly welcome that.
Okay, yeah, because it's kind of around the area there. I don't know if they participate, but it's always, I know some people that kind of are around Toma and La Crosse area there, but yeah, that'd be good.
Okay, we'll go ahead and reach out. Well, I don't see them on the list. We do have some veterans groups in the area that might be a part of that, some consortiums, but we'll make a deliberate request to that office.
Thank you.
Thank you.
Any other questions? All right. Thank you, Abe. Thank you, Joe. And Jim, thanks for being here as always. We very much appreciate getting the updates and getting the heads up on the events that keep you busy. And Joe, you know what? I think one thing it would be nice if you could make a plug also for volunteers. If someone wanted to volunteer at the hospital, how would they go about doing that, or how would they get the ball rolling?
Well, thank you, Kathy, for that prompt. Very much appreciated. Yeah, no, and it's quite timely right now with everything that we're engaged with, and it's an active community right now. But we have about 250 volunteers right now in many different roles throughout the hospital. So we're always interested in more. We have quite a bit of turnover lately, but yeah, like I said, 250 active volunteers, anything from patient escorts to administrative, to maintenance, regular maintenance of our wheelchairs, different things like that. So, and they're just a huge support. A lot of them are coming from our veteran service organizations as well. So it's just a wonderful community up here, but they can, I can put the link for the application, the online application in the chat. And anyone interested is more than welcome to stop up to our office and meet with our team and review opportunities and complete the application in person. So yeah, it's most certainly a group that we rely on heavily here at the Madison VA. I think we logged close to 30,000 hours last year at the hospital. So a very valuable resource. And Jerry and a few of them are on the call right now. So we just wonderful people that we appreciate very much.
So whatever you post in the chat, is that something that we could also share on our, in our
Absolutely.
newsletter?
Absolutely. Yeah, we
Okay.
would most certainly welcome that. And that is on our front facing webpage as well. So we'll forward you that link, and anyone that has questions, you can just forward my information, and we'd be happy to connect them to the opportunity for sure.
Okay. Thanks, Joe.
Yeah, thank
Didn't
you,
mean
Kathy.
to like
No,
blindside
that's
you with
great.
that question or
Appreciate
anything,
it.
but I figured I figured you could handle it. So,
Yeah, thank you.
okay, so our next update is from the Wisconsin Department of Veterans Affairs, and we've got Assistant Deputy Secretary Joey Hoy on the line. And last month he gave us an overview of the budget request that's out there. And what do you got for us this month, Joey?
Well, I'm gonna start off with the budget again. That's sort of what we live and die by here at the department, what the legislature will fund for veterans. For those of you that don't know me, my name is Joey Hoey. I have been with the WDVA for about 2 years. I'm the third one down in the totem pole here. And before coming here, I spent 30 years at the legislature, working for 8 different elected Assembly and Senate members. So I am happy to report that we are in much better shape than we were last budget cycle. Last time around, the Joint Finance Committee had stripped out the governor's requests by this point in the process. They did that almost immediately. This time they have not. It doesn't mean that they're not going to do that, but procedurally, all the governor's requests are still sort of a part of the discussion. Speaking of the discussion, I think, I can't remember if the last time we talked, if I had the dates of the Joint Finance Committee meetings. The Joint Finance Committee, which makes most of the decisions on the state budget, holds 4 public hearings around the state. 2 have already gone by, but 2 are still up and ready to, able to go. I will put that information in the chat as soon as I'm done talking. I'm not very good at multitasking. So, there's, like I say, there's 2 more opportunities for people to go and speak in support of the initiatives the governor's included in the budget. And I'll make our plug once more. Our number 1 priority, the Secretary's number 1 priority is our VORP program, the Veterans Outreach and Recovery Program. The governor took some ARPA dollars and expanded it from 11 to 16 so that we could reach veterans in need throughout the state much quicker and get them the help they need faster. If the ARPA dollars are about to run out, and if we don't get the money from the legislature, we're going to have to revert back to 11 districts, which means longer wait times and potentially not as good outcomes. So I'll put some stuff in the budget or in the chat about the budget hearings where people could either go and testify. There's also a link in that material if you just want to submit written testimony. There's 2 ways to do that I will put in there. The committee will start holding votes in May, so we'll know in May what is or isn't funded before they wrap it up in June. Here at the department, we're doing some work on some administrative rules, which will affect both nonprofit organizations and our CVSO and TVSO partners. We're about finalizing changes in VA2, which is our assistance grants to individual veterans and to nonprofit groups. And that is going over the governor either today or tomorrow and will be sent right over to the legislature. It removes a bunch of requirements that previous administrations here added to the rules that are not found in statute. So there's a whole bunch of hoops in our rules that nonprofit organizations and even veterans have to jump through in order to get grants. There's application requirements, duplicative documentation requests. And so the secretary, picking up on the previous secretary, Mary Kolar's efforts, we are working to make the rules match statute and make the process for applying for those grants much faster and easier for these organizations and individuals. So, and the other two rules we're going to be working on are our county veteran service grants and our American Indian Veteran Service grants, which is the TVSO grant. And again, we're going to remove some requirements that got snuck in there that make it harder for both of those groups to access that money. That one's not as far along in the process. And probably in a couple months, we'll hold a public hearing on proposed changes to that rule before sending it to the governor. But I will have an update on that as we move forward in, the next couple meetings we have together. To prove my active listening skills, I'm going to pick up on Joe's volunteer push. Most of you are hopefully somewhat near Union Grove, our nursing home, which has a very undeserved bad reputation out in the world. It's actually a great home where we provide great service to the veterans. But a big part of the success of Union Grove is our volunteers. We have a really healthy volunteer base, but we're always looking for more. So if you are looking, or anybody in your organizations or circles is looking, Union Grove is always open to having more volunteers. And to build on something Will asked about the tribal veteran service officers, we just we're in the middle of having tours of our 3 nursing homes for the TVSOs. Yesterday, I think they were up at King, and they have yet to go down to Union Grove, but we're trying to familiarize the TVSOs with the services we have for veterans at our 3 nursing homes. So those are my updates.
So Joey, I've got a question for you. On VA2 and do those changes include changes to the, I'm not sure what the grant is called now, but it used to be the subsistence aid grant. And is that being loosened up a little bit?
A very little bit, because most of the onerous requirements are in statute. The governor has proposed some small changes, baby steps to make in that grant, it's healthcare veterans. I'd have to look up the exact title. I'm not very good at that stuff, but yeah, we're working on it. So we're going to do some minor changes to make the hoops less onerous, and then we're hoping to change some of the statutory, impediments to people taking advantage of that grant.
Okay, thank you, because that's just kind of an ongoing.
Yes.
It just doesn't make sense. So
No, yeah.
But it's like the statutory change, I guess, is, we'll hope for that at some point.
It's sometimes referred to as assistance for needy veterans. I think they moved away from that because they didn't like the word needy. But we have in our budget, we have almost $700,000 that has been sitting there. It's one of the things I learned about when I first got here, is that this pot of money sits there because the requirements are so onerous that no one's applying for it. And we've been working on trying to make that better. So yes, hopefully, cross your fingers.
So, okay, thanks for the update. Are there any questions for Joey?
Yes.
Go ahead, Bill.
Hey, Joey, Bill Matthews here. First thing off, appreciate what you do at the DVA. Wisconsin has some pretty good veteran state benefits. With that, I just have a few questions. Right now, for a veteran to be qualified for, let's say, the property tax exemption or the Wisconsin GI Bill, they have to be a resident. If they're not from Wisconsin when they join the military, they moved here because Wisconsin's awesome. there's a 5-year waiting period. Is there anything on the books to kind of reduce that or do away with it?
Yeah, there's been ongoing efforts on both those fronts for many years. There's a Veterans Lobby Day coming up next week, Tuesday. Well, I shouldn't say the big three. The various veterans organizations are sponsoring a lobby day at the Capitol to lobby legislators in favor of dropping the qualification for that property tax credit down from 100% to 70% service-connected disability rating. At this point, they don't have a bill yet, so I don't know if it's going to remove the requirement, the having lived here. Senator Jacques and others have introduced bills repeatedly in the last couple sessions that would do away with the 5-year requirement for the Wisconsin GI Bill. Unfortunately, those efforts haven't gone anywhere, but hope springs eternal, and yeah, people are working on it, but it just hasn't been able to get traction. I know I'm not saying anything that people don't know, but the legislature is not in the spending mood, or they haven't been for the last 10, 12 years, and that would cost money. So both of those would cost money. So, but we are continuing to work, and the property tax credit will be a big focus of that lobby day next week. I'll see if I can find a link to that and put it in the chat. I haven't seen an invite that I got emailed, but it's at the state capitol. They're doing a lobby thing beforehand at the Monona Terrace, and yeah, I think I can get it.
And Jerry might have some more details about that day.
Thank you. Yeah, Kathy, I was going to mention, so registration is at 9 o'clock. Hopefully most people have registered already because they're basing the meal counts on what's registered online prior to. But at 10 o'clock until 11:30, there's going to be a program, veterans groups presenting what priorities are. And then after the program and lunch at 11:30, people will move to the Capitol, and then most of them will march. And then from noon to 1, there'll be Capitol rally in the Capitol itself, and 1 o'clock start meeting with representatives. So I will save this on my phone, send it to myself, and put it up in the chat as well.
Okay, so what you post will include the link, so people can register if they haven't already.
Yeah, we'll try and make sure
Okay.
that the link is there as well.
Great. Thanks, Jerry. And Joey, any other questions for Joey, or did we?
Hey, Kathy, this is Joe. I just had a kind of a clarifying question, taking Bill's question a little bit further about the property tax credit. I know that bill has been introduced in the Assembly and the Senate like probably 5 or 6 times now, Joey, and I know last year it probably made the most progress, with the adjustments made to, I think there was an earnings cap that was written into the bill, and I believe it did make it through the Assembly and to another hearing, but then there was no sessions, like this season ended. Does that bill have to be reintroduced again? And is it the governor's hopes to reintroduce that bill without that income requirement or cap?
So the governor put the expansion in his budget proposal without a means testing. The legislature will probably strip that out because they're probably going to strip out most of what the governor has proposed. But yes, and bills have to be reintroduced each session. So every 2 years, anything that didn't pass dies. You're correct, that bill went farther last session than it ever has before. And that, I think, is a direct result of the fact that they did add 2 means testing tools to that. One was your combined taxable income as a couple had to be under 150, or for individuals under 100. So, then the other means testing was that the credit would only apply for the first $350,000 value of your home. The idea was this would hold the cost down of this credit because it's an income tax credit that you claim on your income tax once you prove you've paid the property taxes. So it's going to cost some money, and the legislature, there are a number of current members of the legislature who are worried about the cost. It did pass the Assembly, and we thought it was going to pass the Senate. It was actually on the calendar for a Senate session, but at the last minute, there turned out to be a lot of confusion amongst the state senators about what it meant to have 100% disability rating. At least 3 of the majority party thought that meant that you didn't work. And there was a lot of confusion on the day of the vote, and they pulled that bill from the floor because there was, well, confusion. And then the idea that somebody, could be making a lot of money and get a property tax credit that somebody else doesn't get proved to be too contentious. And the bill did die once again. Okay. A bill has not been introduced yet, and that's because the veterans organizations are working with legislators, and it's not clear yet whether they're going to introduce a bill that already has those means testings as a part of it, or whether they're going to start with the whole banana, try to get the full credit and see how far that moves. So it's all up in the air.
All right. Well, I appreciate the detailed update, and I'm hoping the 5th time is the charm. So thank you. I appreciate it. Thanks, Kathy.
Thanks, Joe. All right. Last opportunity to hit up Joey with any questions. Okay, so I'm going to read Jess from Team Red, White, and Blue provided some comments in the chat. They've got some activities coming up, and she's working hard and unable to join us verbally. So but they have regular Monday meetup. They've got on the 5th of May a big barbecue social and fly fishing gathering. So I don't know where that is. We will get more info and post it on our website, on our events page on our website, along with the other events that have been mentioned here on all of them. So you can always visit our website, VetsCAN-wi.org, and then go to the events page. And that's kind of,
I'm here. I just jumped into a room real quick. I won't take much time, but so just to let your respond to your question about the app that we have, the reason that we have you have to log into it to see about our events is that we value like the privacy of the vets who sign up to go. And we've had some, concern about like incidences of like a person who has someone that's a stalker and they don't want their stuff to be online. So when they developed this app, which a member can log into and then see all the events, they took that privacy concern into account. So that's why it's password protected. But yeah, Team RWB is free for all people, everybody. And then veterans get a free t-shirt when they join. So there's no like financial cost.
okay. So like no annual dues or anything like that, or
No
just...
dues. We don't try to sell you anything. I don't sell anything. I work for the county. So, like we're just all volunteers too. And yeah, so.
Okay, great. Thanks for that update and that information. And again, check out the blurb or the comment in the comment section that just left, and anything that yeah, that we can share, just keep us informed, let us know, and we're happy to share that.
Yeah,
just
you
that
can definitely
information
share
out.
it. It's just that if people want to like RSVP, then they should go
Yeah,
through the app. But yeah,
okay,
the big meetup on the 5th is at Vilas Park. Starts at 6 p.m., 5:36. And then Never Miss a Mondays are happening every week at Garber Feed Mill at 6 p.m. So that's just to start a couple of examples.
okay, great. All right, going around the horn, is there anybody else that has an update or an announcement to make? I don't see any raised hands. All right, then we'll move on to our featured topic. So I was able to find some data from 2023 published by the VA. And what it told me is that in that year, there were, in round numbers, 120,000 patients, unique patients, who received medical care from the VA at a cost of well over $2.1 billion. And I know the first time that I heard that number, it was staggering to me. Like how much, and that's just medical care, and how much is paid to Wisconsin veterans, comes into the state of Wisconsin through veterans from the VA. But as maybe and maybe I'm unique in this, but as astounding as that number is, those 120,000 patients represent only 37% of all of Wisconsin veterans, at least at the time, at the time of this data, 2023. Which is almost more staggering. And we know that, and we have known that, you know, the majority of veterans do not receive their care from their health care from the VA, which is why we, VetsCAN, is working to educate the civilian providers and those that don't see themselves as kind of working in the veteran space. They are in the veteran space, and they have they have to realize that. So anyways, so a veteran's, the rating that a veteran receives from the VA can affect whether that veteran receives care from the VA or whether they receive care from somewhere else in the community. Today, we're pleased to have from joining us to talk about VA disability ratings is Kia Lohr, the supervisor from the Wisconsin Department of Veterans Affairs Claims Assistance Office in Milwaukee. So Kia and her staff assist veterans with the development and filing of their claims to the VA. Services like this, they are not unique. Services like this are also provided by your county veteran service officers, by service officers from the veteran service organizations like the American Legion, the VFW, DAV. I think there are some others, I think, but I don't want to misspeak. So I'll stop there. But in all cases, those staff are trained and accredited to provide that advice and assistance to veterans. As I mentioned earlier, we also, to kind of supplement or be available for questions, we've got Steve Westfall also will be available after Kia's presentation to answer questions. So with that, Kia, and FYI, we didn't rehearse anything. So if we've got to do any slide sharing, we're going to work it out right now on the fly as we go. But I'll turn it over to you, Kia. Thanks for being here.
Thank you. I'm just going to share my screen.
Are you able to do that or?
Yep.
Okay, perfect.
Okay, awesome. So again, good afternoon and thank you for inviting our claim section to this engagement forum. My name is Kia Lore. I am the Veteran Program Supervisor here for the Wisconsin Department of Veterans Affairs Claim Section. Okay, want to make sure I didn't go too fast. Today, I'm going to give you an overview of the claims office background, the governance and policy, different types of claims, and the claim process. A little bit of history about WDVA. In 1919, the state issued its only wartime bonus to Wisconsin veteran of World War I. In 1945, rather than issue a wartime bonus with little lasting value, the legislature created a program that offered a long-term benefit for the state veterans and their family. The Wisconsin Department of Veterans Affairs was created by Chapter 580 law of 1945 to ensure that the state veterans receive the state benefits to which they are entitled and to assist them from securing their federal veteran benefits. An overview of the claims mission. Department of Veterans Affairs is to work on behalf of our Wisconsin veteran, their families, their survivors, to direct, provide, or inform them of available benefits and services. The department includes our central office in Madison, a claims office here in Milwaukee, the Wisconsin Veteran Museum, the Wisconsin Memorial Cemetery, and 3 Wisconsin Home. We work with veterans to obtain jobs, housing, state and federal benefits, education, emergency funds, veteran administration services, medical care, disability determination, and many other benefits and services. WDVA claim section advocate for our veterans throughout the claim process. WDVA claim section is located at the Milwaukee VA Regional Building, west from the VA Zablocki Hospital. We do have 2 claims officers located off-site at our Union Grove and King homes. Our hours in operations are from 8 a.m. to 4 p.m. Meet my team. So to the far right here is our division administrator, Jeremy Lyons. To the far back here is our director, April Himes, myself, and then the rest of my team, claims officers, and 1 operational program associates. In compliance, the policies and regulation, USDVA is governed by Title 38 of U.S. Code of Federal Regulations, CFR. Referencing CFR, hearing preparation has been beneficial to receiving a favorable decision for veterans in the past. Claims officers should familiarize themselves with the regulations in order to best serve the veteran seeking claim assistance. Accreditation is solely purposed for providing representation services to claimants before VA and does not imply that a representative is qualified to provide financial planning services or otherwise endorsed by the VA. Accredited individuals are responsible and qualified to provide representation on VA claims. Claimants should exercise and be cautioned when selecting representation. WDVA does hold accreditation training once every quarter. To the right, you will see our link and QR code for registration. WDVA does have a monthly training every 3rd Thursday of the month, which was today. We just had at 2 this afternoon. These are topics upon our partners, county, tribals requests, or most asked question in the office. These trainings is a 2-part training between the claim section and our VBRC, Veteran Benefits Resource Center. Again, today I will cover 8 topics. Both Steve's team and my team do work hand in hand. So Steve, feel free to jump in. Compensation claim. VA disability compensation offers a monthly tax-free payment for veterans who had gotten sick or injured during their service in the military, and to veterans who served or service made existing condition worsen. There are different types of claim. Many qualify for VA disability benefits for a physical condition, more likely like chronic illnesses or injury, and mental health condition like PTSD that develops before, during, or after services. Compensation may also be paid for post-services disability that are considered related to or secondary to the disability occurring in services, or for disability presumed to a related circumstance of military services, even though they may arise after services. The different types that I have listed here are the direct service connection. That is a condition is directly linked to a veteran military service. A secondary condition, a new disability, is caused or worsened by a condition that is already a service connection. Presumptive service connection. Certain conditions are presumed to be service connection based on specific circumstance. For example, it can be Agent Orange exposure or Gulf War syndrome. Aggravation, a pre-existing condition is worsened by service. Special claim, claims for specific issue, like again, the Agent Orange exposure, radiation exposure, Gulf War syndrome, or other conditions with specific service-related connection. The original claim, it's the first disability claim filed. Increased claim, claims to increase a disability rating when a condition worsen. Post-service claim, claim for disability that appears after discharge. And then last but not least, the special claim for special need. These are typically claims for benefits related to special needs, such as automobile or clothing allowance. Also, we have the 3 key elements for service connection. They must establish the stressor in in-service event. There must be evidence of the event, injury, or illness that occurred during the veteran's active duty. This could be a direct in-service, a disease contact, or connected or immune that popped in and out throughout the service, or even a stress-related condition like PTSD. They must also have a current diagnosis. The veteran must have a current diagnosis of a physical or mental health disability. This means the condition is present and needs to be documented throughout their medical record and exam. And last but not least, the link. We always need that medical link. So the medical nexus, we need to make sure that the link is between the service connection event and the current disability. This is often done through a medical nexus opinion, which explains the connection between the two. The opinion should also state that this is an in-service event, at least as likely as not to have caused or aggravated during service. Essentially, the veteran needs to prove their current condition as a direct result to their military service. Presumptive service connection is a context of VA's disability benefit, meaning the VA presumptions, assumptions that contain disabilities were caused by the veteran military service. This eliminates the need of a veteran to provide extensive medical evidence or a nexus link between their condition and their service. The VA has established specific lists for conditions that are considered presumptive. And if a veteran meets the criteria, an example of that, serving in a particular area or time frame, their condition is automatically recognized as service connected. In most cases, if the VA believes the disability is related to the military service, known as the presumptive service connection, and receives a claim within 1 year of separation from active services, then the effective date is the date of the illness or injury that begins. If the VA receives a claim more than 1 year after separation of their active duty service, the effective date is the date the VA received the claim and or illnesses or injury begins, whichever is later. And there are some examples of the presumptive condition. It can be a condition related to Agent Orange exposure. Some of the examples of that are certain cancers, heart disease, diabetes, conditions related to the burn pit exposure, condition related to radiation exposure, condition related to Camp Lejeune contaminated water, conditions related to the Gulf War. Some of the examples can be cancer, chronic diseases, condition related to mustard gas exposure, condition related to serving as prisoner of war, and then certain tropical location. Benefits of the presumption service connection simplifies the process of claiming service connection disability benefits. It reduces the burden of proof on the veteran. It allows the veteran to receive benefits more easily without having to provide extensive documentation. And how to establish the presumptive service connection. The veteran needs to demonstrate that they served in a qualified situation. So that can be, again, serving in specific locations or was exposed to a certain substance. They can also show that they were diagnosed with a presumptive condition, and they need to provide medical records or other documentations to support their claim. Pension is a need-based benefit paid to wartime. Veterans may generally be eligible if he or she was discharged from service under other than honorable condition, served 90 days or more active military, naval, or air service with at least 1 day during the period of war. His or her countable income is below the maximum annual pension rate, meets the net worth limitation, is age 65 or older, or is shown by evidence that they have a permanent and total non-service connection, or is a patient of a nursing home, or is receiving Social Security. Veteran who enter active duty after September 7th of 1980 must also have at least a 24-month of active duty service. If the total length of service is less than 24 months, the veteran must have complete his or her entire tour or active duty. DIC survivor's pension and crew benefits. The dependency and indemnity compensation is a tax-free monthly benefit paid to eligible survivors of a deceased veteran or a service member. Generally, this includes survivor's pension, surviving spouse, children, and parents. To qualify, the veteran must have died while on active duty from a service connection injury or disease, or have been receiving compensation for service connection disability rated as total disabled. VA survivor's pension offers monthly payment to qualified surviving spouse and unmarried dependent children of wartime, veteran who meets certain income and net worth length is set by the Congress. December 1st of 2024 to November 30th of 2025, the net worth limit to be eligible for survivor's pension benefit is 159,240, if I can think if that's correct. And Steve, feel free to jump in if that number is not correct.
Yeah, I'm not going to be able to comment on that whole DIC survivor accrued issue. Comes to compensation, I'm all there for you.
Okay, no worries. But I think I'm pretty accurate. That's the number. And if not, it's probably slightly higher, but I'm pretty confident it's 159,240.
Ian, this is Cherry Hook.
Mhm.
This is one of those things that we as a veterans community need to help get the word out on. And it's so important for those families that qualify to even understand that they are qualified for it. I've worked with several in our community, but most of them don't even realize that it's out there and that they would be able to get some sort of compensation. So it is critical that we talk about it and that we spread the word.
Absolutely. I totally agree. And if your child's net worth is more than the net worth limit, VA does not consider them to be a dependent when VA determines the pension. Accrued benefits are benefits that are due but not paid prior to the beneficiary's death. Burial. Under the current regulation, VA paid for burial and funeral expenses on a reimbursement basis, which requires survivors to submit receipts for a small one-time payment that the VA general pays at a maximum amount permitted by law. The new burial regulation will permit VA to pay at a flat rate burial and plot or intimate allowance, thereby enabling VA to automatically or automate payments by burial benefits to most eligible surviving spouse, or more efficient process other than burial benefits claim. The burial allowance for service connection death, VA will pay up to $2,000 towards burial expenses for death on or after September 11th of 2001, or up to $1,500 for death prior to September 11, 2001. If the veteran is buried in a VA national cemetery, some or all of the costs of transporting the deceased may be reimbursed. For the non-service related death, VA will pay up to $769 towards the burial and funeral expenses for death on or after October 1st of 2019, if hospitalized by the VA at the time of death, or a $300 towards burial and funeral expenses, if not hospitalized by the VA at the time of death. There are three options of review. There are three different types of appeals. I will review the higher level review today, supplemental claim, and the appeal for the Board of Veterans Appeals. The higher level review is a informal conference for veterans and their representatives to discuss why the decision was an error. We typically need to prepare and explain why there was that error, known as a clear and unmistakable error, or if there was a duty to assist error, or the differences of opinions. In this appeal process, no new evidence can be submitted. An experienced claim adjudicator will review the decision using the same evidence VA considered in their prior decision. The claimant and or the representative may request one formal conference with the higher level reviewer to identify any errors in law or fact VA made in prior decision. VA must receive the complete VA form 20-0996, the date of notification letter of the prior decision. The claimant may request for a higher level review for most decision, except for another higher level review or a board decision involving the same decision or issue. A supplemental claim allows veterans to request for VA to reconsider a initial decision on a disability claim by submitting new and relevant evidence that wasn't part of the original claim. This evidence can be used to show a connection between the disability and the military service or to support the claim for additional benefits. What is the contested claim? A contested claim is a VA system rise when the benefit is claimed by multiple individuals, but only one can receive it. This can lead to a situation where a favorable decision for one claimant result in a denial or reduction benefit for another. What does that mean? The contested claim occurs when there's a situation where a benefit such as a dependency allowance or a family dependency claim is claimed by two or more individuals, but the ruler only allows for one of them to receive the benefit. An example of that will be, I can give is if both a veteran surviving spouse and a child claims the same dependency allowance, and the rule states that only one can receive that, then it becomes the contested claim. New and relevant evidence to cement any evidence that or information that was not submitted with the initial claim is considered new. The relevant evidence, information to provide or disprove sometimes on the claim unless the supplemental claim is based on a change in law. You'll need to submit supporting evidence that's new and relevant to the application to be complete. They need to make sure that they can also identify evidence that you like the VA to gather for them. And please know, if you have new and relevant evidence, you can also request a board appeal, but the process may take a little longer. And if you're adding or identifying new and relevant evidence to support your claim that the VA did not previously consider, VA will assist you on gathering those evidence that you identified to support your claim.
Hey, Kia, I'm not sure, did the slides get stuck, or was there not slides for the new and relevant and whatnot?
No, I just condensed them together.
Okay, just
Yeah,
checking.
I just condensed them together, but if you look through the chart here, it does go through like the different lanes and how we can move to the court appeals down here, but yeah.
Yes, and for those of you on the call, it can be extremely confusing and frustrating for a veteran. We can't encourage you guys enough to push for your veterans to seek out counsel and guidance from a service organization or CVSO. They will help you through every step of the process and will help explain these steps because they can be extremely confusing. So I just want to push that out there for you.
Thank you. I added what is the nexus on here because of the new and relevant evidence. We're always requesting our veterans to provide us a nexus statement or a nexus letter. Typically, that is a document that a doctor or other medical professional prepares for a veteran. And it explains that the veteran's current medical condition is related to their military service. Ideally, it's a physician's opinion, especially in the form of a nexus letter. it can be a very valuable tool in a disability claim if it's done correctly. And then we also need to make sure that we're communicating with our veterans and our veterans are communicating with their physicians to write the nexus letter in detail as they can and include it into that letter. So a good nexus letter use specific languages, include specific phrases, and ties the fact together to draw the conclusion about service connection. Medical condition, medically, certainty is a much higher standard than the VA requires. In order to avoid a situation where a doctor applies the wrong standard, we need to make sure that the VA terminology is explained to them. For example, the term more likely than not should be used to express that there is a 50-50 more likelihood to the veteran's current disability is related to his or her service. Or using other term that may lead the veteran, the VA to misunderstand the opinion as not supporting the service connection. The BVA Board of Veterans Appeal is part of the VA and it's located in Washington, D.C. Members of the board reviews benefit claim determination made by local VA office and issue decision on appeal. These law judges are the only one who can issues these board decision. So if you see here on the screen, this is the process on how it goes in. If the veteran decides that he or she does not agree to the decision, and we've gone through every hoop that we possibly can, and there's no more loopholes. At that point, myself or my team will discuss with the veteran on filing a notice of disagreement to the board, which we will complete the 10-182 application. That process, the BVA will notify our veterans that they received the application. The next process to that will be placed onto the docket. Once it's placed to the docket, it will come to the scheduling hearing, and after the scheduling hearing, the hearing can be conducted. Now, I know that on here we state it's a process. This going to the BVA appeal can take up to 4 years. So it's more likely that we try to avoid the BVA appeal and try to utilize the other 2 appeal process as much as we can. The appeal process in our office, and I can only speak about my office, is how we prep our appeals for our veterans. We need to make sure that we are combing through their entire file. We're making sure that we are reviewing all denial decisions. We're making sure that we are reviewing the medical evidence. We're reviewing the C&P exams. We're reviewing any new material evidence. We also need to make sure that the veteran does meet those 3 elements, as I stated from the beginning: the stressor, the diagnosis, and the link. From there, we prep our argument of why it should be service connected. And by doing so, we do reference the CFR 38 and AM21 to support our case. There is a proposal to reduce. The VA process to propose to reduce disability benefit includes potential eliminating benefits for some veteran, ending total disability based on the individual unemployability for those who cannot work after retirement ages, taxing VA disability payments, and reducing benefits for veterans with low disability rating. The proposal have a sparked condition among veterans and advocates. So if the VA receives a medical evidence that show the condition has slightly improved, or it has improved, or it's possibility. These are words we try to avoid. Most time, our veterans are not very good narrators. They don't advocate for themselves. So more likely in our office, we will inform our veteran to make sure that each time they are meeting their physicians, psychiatrists, or clinicians overall, to make sure they are discussing their condition at its worst. Why do we say at its worst? Because most likely when the veteran is in pain at its worst condition, typically they kind of have to rate the pain from a scale from 0 to 10. By 8, you're going to the ER. Otherwise, you're scheduling an appointment with your physician. If you're going to the emergency room, more likely they will review the condition, they will look at it. They'll provide you with some medication and call it a day. And if the condition worsen, to follow up with the primary care. And or if the veteran just schedule an appointment with the primary care, more likely by the time they do see the physician of that scheduled appointment, that pain is no longer there. That is the reason why we say our veteran is not narrating or advocating for themselves, because typically when they do seek the assistant or do make it to their appointment, that pain may not be at its worst. It is now at its minimal and it's bearable. So we need to make sure that we are narrating at its worst so that the condition can actually have the proper diagnosis. Proposals to reduce can also inflect veterans who are currently in jail or in prison for at least 60 days or 61 days. Proposal can reduce can also be the individuals who are rated at 100%, and that's typically prostate cancer or mental health condition. And the reason why I like using prostate cancer is because prostate cancer can be curable. Why do we say curable? Typically, if a physician does suggest surgery, by having surgery, the cancer has been removed, but you're now in a remission base, it can be proposed at a lower rating that's warranted to the condition. And it all varies. I've seen 100% to 60%. I've seen 100% to 30%. I've also seen 100% to 0%. So it all varies on a specific condition. Our veterans have 30 days to request for this personal hearing if they wish to contest the VA decision, and 60 days to submit evidence of the reduction that's warranted. The VA cannot reduce the Veteran Service Connection Disability Rating without first sending a notice. Failure to do so should result in full reinstatement of their benefits. I added this last piece into the presentation because we don't touch incarceration or fugitive felon status enough. My team does conduct a briefing with Dodge Correctional. And so that's one piece why I wanted to touch base on this. Most of our veterans who sometimes run into issues with law enforcement and the criminal justice system resulting into incarceration. It's important that the justice involves our veteran, their family with VA benefits, including what VA benefits may still be eligible to receive, what happens to the VA benefits they are receiving or already receiving, or if they become incarcerated, and what are programs that are available to assist them with integrating back to the community once they're released from incarceration. So if a veteran has been incarcerated or in jail for 60 days or more, the recipient who is receiving pension payment will terminate effectively as of the 61st day of imprisonment in a federal, state, or local institution for convictions of a felony or misdemeanor. Payments may be resumed upon release from prison or any of the local or federal, state institution I mentioned earlier. Failure to notify the VA of the veteran's incarceration could result in a loss of the financial benefit until the overpayment is recovered. If the veteran is incarcerated, they can request for apportionment to the spouse or children. All or part of the compensation not paid to an incarcerated veteran may be apportioned to the spouse, to their child, children, or dependent parent on a base of individual need. In determining individual need, considering shall be given to such factor as the claimant's income, the living expenses, the amount of compensation availability for the portion, the need of living expenses of other claimants, as well as any special needs, or if any of all claimants. And then restatement. If a veteran is being released from one of the facility, as mentioned earlier, we need to make sure that we are reinstating their benefits. So by doing so, we need a letter of release. It can be a letter of release from the facility that they were released from. It can be a letter from their correctional officer. It must be on a correctional letterhead to be accepted. Then we also need to make sure that we are submitting a 4138 requesting the VA to reinstate the veteran benefits. Thank you. Do you guys have any questions?
Well,
Go ahead.
oh, so thank you, Kia. What a fantastic presentation. And, you know, I just to illustrate a little bit, it's like I've got this old copy of like Veterans Benefits Manual. It's a national publication. It's from almost 15 years ago. But in here are all the details of what Kia has been speaking about. It's just incredible. And thank you, Kia, to you and your team for what you do for veterans. So, Jeremy Schmidt, you've got
Yes.
a question. Go ahead.
Yeah, so I'm actually working with a veteran who I found out is 50% approved for service connection, but he cannot receive it. On his DD-214, he had time loss of more than 180 days. Is there any way of getting that, like, I don't know, waived or like switching it or?
It varies. It depends if the veteran was charged. Did he go to court martial? Was there a character of
There was,
discharge?
it was other than honorable.
Okay.
Yeah.
Typically, sometimes other than honorable, it also varies to see if they fall under chapter 7, chapter 14, chapter 16, chapter there's
Right.
another chapter. It's not on top of my head right now. I apologize.
Sure.
But some chapters does not allow the veteran to receive the monetary payment, but only for VA purposes, meaning for medical and healthcare. So
Yeah, that's right. He's not eligible for medical or health care because of that too.
gotcha. So if you reach out to me, and I don't know if the veteran is working with WDVA, because they may work with American Legion, DVA, VW, PVA, one of the service organization here. If they have appointed WDVA as their representative, I can look at it a little bit more in detail.
Okay.
And
Yeah, guys, DD-214. Yeah. So, okay, thanks.
I want to add one real quick thing. It really depends also on how old that rating, or I'm sorry, that character of discharge decision is. If it
Right.
was recent, or if it is a few years back. I know there's new law that as of the last, I want to say 2 years or so, any character of discharge issue that comes across has to now be reviewed again and
It was early
revamped per
2000s.
se for the new laws.
Let's say early 2000s off the top of my
Yeah,
head.
then I would definitely reach out to that veteran
Okay.
and encourage them to seek a new character of discharge decision, because that could greatly affect the
Yeah,
outcome
maybe increase it or something.
based upon the new laws. Maybe he won't get compensation per se, but he could be eligible for healthcare benefits.
Got it. All right, thanks.
Let's see, there are a number of comments that came in during Kia's presentation. And I'm going to attempt to save these comments so that they will be, and I'm not sure if they'll be included in our recording, but Connie had asked about the reducing benefits for mental health conditions, specifically which one. Steve answered that the VA can always reduce for any condition that becomes better over time. A veteran, I believe this is, for example, could be rated at 70% for PTSD, could go through programs, et cetera. And if a routine exam was scheduled, upon that examination, the veteran could be reduced based on their current severity. Thanks for that response, Steve. And I think Connie already signed off, so.
Yeah, I want to add into that.
Yeah.
You've got to be very careful as a veteran not to push your limits. Okay, like if the condition has theoretically gotten worse and it truly is worse, that's one thing. But if they're just looking to increase their compensation payments, and let's say they're at 30% for something, and they go back in for an increase exam, and that increase exam suddenly shows that that the condition is better than the last time they were in, we will propose to reduce, and they could get their overall reduced as well.
Okay, thanks for that, that information. Jeremy, great plug for Yvonne and her team over in Jefferson County.
Yes, I'm a Jefferson County resident myself, so and a veteran.
Well, thanks for joining us from all the way over there.
Sure.
And there have been a couple of requests, Kia, for the slides. Will you be able to share those slides with us?
Absolutely.
Great. And then if you're subscribed to our newsletter, we generally provide that information. So our next newsletter will include the link to the video to the YouTube channel, and then we'll also include Kia's presentation, the PDF of her presentation.
Should I just email it to you?
Yeah, or Joey or whatever is easiest. Yeah,
Okay.
if you send them to me,
Okay.
that would be great. Michael Hankey, question, go ahead. Michael, you're on mute if you're speaking. You'll need to unmute yourself. Maybe his hand is raised by mistake. Jerry, you've got a long comment. Is there something you wanted to bring up, or were you just?
Yeah, when I took Dad in on Monday to see the VA dentist, and he reminded me how when he went to boot camp in World War II, they pulled 4 of his teeth because he was going to be on a ship. And at that time, that was just what they did. His records are gone. There's no proof. We would have to probably do, a statement from him, a statement from us, maybe get doctors to say that he's had issues with his teeth ever since. But initially when I talked to my dad the other day about it again, I kind of thought, well, it's a lost cause. But maybe there's something to it. Maybe I put it in and see what they say. But the fact that he's now going in for heart valve replacement, they had to look at all his teeth. He's only got 2 left and they've got to pull both of those. So he's gone through life with dentures and a plate. So it may be worth looking at it anyway. So I appreciate it.
Let me say something to you, Jerry, real quick. By the way, they still pull your wisdom teeth in boot camp. They still do that. That happened to me back in '98. So that's still a thing. And by the way,
sorry, Steve, that wasn't that recent.
Yeah, right. But further, the only way you can service connect an individual for a dental condition is if it was a precarious condition or if there was actual dental trauma. So if maybe it was during pugil sticks and you got smashed in the face and lost some teeth, that's the only way that you can actually get service connection for a dental condition.
Okay.
And I have to drop off, guys. I'm super sorry. I've been here since 5:40 this morning. If there's any question, I'm sure Kathy can reach out to me and I can get some answers and get those back to Kathy and she can revisit them and shoot them your way. Kia, you did a fantastic job. Excellent, as always. It's nice seeing you. And for the rest of you, I am here. I'm the public contact team supervisor here at the VBA. If you guys have issues, my contact information can be floated around. Please don't hesitate to reach out to myself as well, and we'll see what we can assist you guys with. And I will be looking forward to the next meeting. I think it's in May sometime, so I should be on that one as well, Kathy.
All right.
Just give me the information, okay?
Yep. Thanks so much for being here, Steve. Appreciate it.
Okay, take care.
So, Jeremy, you asked about obtaining medical records from 20
Yeah, like 20
years
plus
ago.
years. I got a veteran that's looking for his records from the 80s. Yeah, he was in the military for a few years, like 4 years or something like that.
Okay.
So.
Did he? So it can go multiple ways. Okay.
Mm-hmm.
He might have taken his record home and never submitted it back, so the record is completely gone.
Yep.
If he still has it, I always advise the veteran to look. Okay.
Mm-hmm.
Otherwise, we can always you can always go to the National Archive.
Yep, in St. Louis.
And request for it. And then another is request out to Steve's team and request for a FOIA to see if the veteran, if National Archive did send the medical records over to the VA.
Gotcha. All right. Yeah, I think he is eligible for VA, so he's going there. But just it's got so many issues that he thinks it's, he's in Honduras or something, I think.
Oh.
So, yeah. Is there any kind of service connection for presumptive conditions from Honduras? I don't see that.
I don't recall, but I wouldn't be surprised.
Okay. Yep. So, I told him to see the VA or VSO. So,
yeah.
So, Michael, can we try again?
Yes, let's try this. I have really poor coverage, so I apologize, but thanks, Kia, for the great presentation. I remember your time when I was at Klein Hall.
Oh, yes.
Yeah, a big thing that we receive, I now work for Congressman Van Orden doing veteran services and outreach, is a big concern that we have that comes from our Vietnam veterans is with the presumptive illnesses of hypertension. And a very high number of them come back at a 0%. And so for those stakeholders out there that may be working with some of these veterans, when I get to cases, I just let them know the importance of that 0% rating, because if they will pass from hypertension what's on their death certificate, then their surviving spouses are eligible for DIC. And so that's just a really, I think, an important point to share, so that the stakeholders out there, advise them that at 0%, there's no monetary benefit there. However, there is a benefit for your surviving spouse. And that's kind of all I wanted to mention. But I do appreciate your presentation, Kia. It was phenomenal. Thank you.
Thank you.
I actually had just one more question on top of that.
Yeah, go ahead.
So I have a veteran, Vietnam veteran, 100%. Has one child who's an adult, not married. The other one are married, but So if the veteran passes away from a service connection, would that other adult child get DIC, even though they're not living together?
So it varies.
Okay.
Okay. So for DIC, typically DIC is usually just for the surviving spouse and or dependents or parent if they meet the criteria. For dependents, you have to be under the age of 18,
Gotcha.
or otherwise they're considered a helpless child,
Mm-hmm.
then they will be eligible.
Gotcha. Yeah, they're working. Is IT or something. I don't know.
Yeah.
So, all right.
Well, thanks so much for Kia again. Thank you
Sure.
so much. And thanks for the engagement for folks that are left on the line. Kia's again, check the messages. Kia dropped her email address in there. We'll capture that so that we've got that in the future and can bug you, Kia. So
Absolutely. Absolutely. Feel free to reach out.
so we are, yeah, so we're over time. Thanks so much. And look forward to our newsletter coming out hopefully at the beginning of May, and hopefully we'll see everyone again next month. Take care.
Thank you. Thank you for having me. Have a good night.